Hey Lisa,
Hi.
my name is Riley. I'm a Youngstown State student nurse practitioner.
Uh-huh.
Today we are going to be doing a quick interview of you. It should take roughly about 10 minutes. I just want to thank you for your time now so I don't
Sure.
forget at the end.
Sure.
Can you just tell me your full name,
My
your
name is-
title, and your specialty?
My name is Lisa Pastor. I am a nurse practitioner in family practice. What else did you ask me?
And your specialty.
My specialty. That's just family practice. So.
Family practice?
Yep. So I've been an FNP. I graduated last May, and I've been practicing since July in a family practice in internal medicine setting.
Internal medicine.
Right now, we have one doctor, she's internal medicine. In the summer, we'll be getting a family practice doctor. So right now, I don't see children because my doctor doesn't see children, but I will be starting to see children when the new doctor gets here in the summer.
Okay, so it'll open your scope a little bit.
Yeah, I will probably only see about like 5 and up, I think will be our cutoff point.
Okay. Tell me a little bit about yourself.
I started off as an LPN. I worked as an LPN for 10 years. Then I was a 2-year RN, worked in the ER for probably 14 years, the other 14 years med-surg. I got my bachelor's degree and went straight on to get my master's. So I bring 24 years of nursing to the table.
That's very good to hear.
Mm-hmm.
Describe your position as an APRN.
I see lots of new patients so that I can spend some more time getting to know them, what their needs will be. I see the patients that maybe there's a doctor in Talmadge who's full. They will drive over to Stowe and I can see them here. So just for like a sick visit. I do a lot of Medicare, like their annual exam. They have to have, do you nail down your carpets? Do you like have any fall? So we do like a lot of, I don't know, like preventative care.
Kind of like a home safety checklist?
Home safety checklist. How's their mentation? Are they doing it? Like, can they still go grocery shopping for themselves? That sort of thing. So I do a couple of those a week, but I would say for the most part, I see a lot of new patients, and being so close to the college, I see lots of college students.
Lots of college students.
Yeah.
Do you see an influence in today's healthcare system?
Yes, because we have so many new people who don't have a PCP. I see a lot of people that are in their 60s and haven't been to the doctor in 30 years, so they have no idea what their diabetic status is, what their cholesterol is. So we have been, I think, a huge push in getting all these people in with no doctors, because there aren't enough family practice doctors, honestly.
Do you feel like clients or patients of yours feel more open to speaking with you versus a physician?
Yeah, I feel like we have that bedside manner that you don't maybe always get. I think with a doctor, we talk about all the things. I have a lot of people who are like, I've never come to the doctor because I'm afraid to know what's wrong with me.
Right.
And I'm like, okay, well, let's get to the bottom of all of this, because we'd rather that than you just have a stroke one day and not know why.
Right, right.
So.
What are some barriers you face as an APRN?
Well, for the state of Ohio, of course, we have to have a doctor that we have to have a whole signed agreement with. So, and that's fine. I don't feel like she really gets involved with my patients at all. It's nice because I can go to her and say, this is your patient, what do you want me to do with them? So I think that's great. And that you have that. I think there are probably certain hospitals that now want the nurse practitioner to be the primary care, so you wouldn't have that as much, and I think that would be maybe a disservice, especially if you're newer, as a nurse practitioner. I actually feel better knowing that she's here, and if I need something, then I would be able to go and ask her, and she's always very approachable, because these are her patients, honestly.
Right. Do you feel as if it's more of a collaborative relationship versus a competitive?
Exactly. She's there to say, you could try this or this, see what the patient wants to do. It's not her telling me what to do, it's her just giving me some ideas what she might want to try, or which path that we should lead down. So I think it's good, especially being like a newer grad, even with 24 years experience, there are still things I don't know and I learn every day, so.
In relation to that, do you feel more like independent versus codependent of the provider?
I feel pretty independent. Sometimes I'll get someone, I think the hardest part is when they've been in like the hospital and they're very complex and they have 92 different medications and they're 92 years old and they want to come in and you have to go through their whole chart. What did they do at the hospital? They were in the ICU, they were here, they were there. I mean, it's a lot to look through. That for me is like, really overwhelming, I think, as a new grad. I think it's like, you know, where do we even begin? Trying to dice through, you know, so many different specialties. Who did what? Do they need to stay on all these different medications?
Right.
And that's why documentation is so like important, I think, from that whole like standpoint of knowing why did you put them on all these different meds? Do they need to stay on them long term? You know,
Are there interactions?
Right, with all the other meds they're already on, exactly.
Gotcha. And then what are some changes that you would like to see made for APRNs?
I would hope in the near future, you would have to have some maybe years of experience before that you were allowed to go back to school. I see a lot of like brand new grads, they get their 2-year RN and they right away want to go right into being like a nurse practitioner. That to me, I think is a disservice. I think it cheapens what we get paid. I think that we should be getting paid more. I mean, I'm only really making $5 more an hour than I was as a staff nurse, you know, and it's a lot more responsibility. You know, you're doing a lot more than we were doing at the bedside. And I also think that, you know, if you have experience, they will trust you more. If you're, you know, like 25 and you have no experience being at the bedside, seeing like a sick like patient, seeing all the different medications, all the different things that may happen, I just feel like that lessens our, I don't know, like expertise, I guess.
Kind of like a lack of trust.
Lack of trust, yeah. I think that you should at least be like at the bedside for at least like 5 years. Just like the CRNA role, you have to have what, like 1,000 hours in the ICU, I think, and I think they have to have a couple of years in the ICU as well as the emergency room or one or the other. But this whole like notion of just wanting to go straight to the top without any experience in between, I think is silly.
Seems like a lot of people are just chasing it for the money.
Chasing it for the money, but because as a new grad, yeah, that would be a huge jump in pay, but do you really deserve it? Do you have like any expertise at all in the
What's
field?
your experience?
What are you bringing to the table?
Right.
Yeah.
And then just one last question, just for my personal gain.
Yeah.
Do you have any recommendations or advice for new nurse practitioners?
For new nurse practitioners, like new graduates,
Yeah,
or
new graduates or
before you graduate,
people
or?
that are about to graduate, just like that, population of students.
Yeah, I feel like I would start right away, maybe shadowing different fields. I thought I really wanted to stay like inpatient, and I shadowed there in a couple different roles, and I just realized that's not what I wanted to do. I felt more like just like a bedside, you know, the doctor still made 100% of the like decisions. You were just basically going to do the rounding for them, going back to tell them, and they would tell you what to do with the patient.
Kind of the middle.
Kind of like what we do now, you know, like as an RN. I also think that boards were fairly stressful, and I would start to work on some of those like questions now. It helps you to start getting into the mindset of what's expected of you. I think it's a different kind of question. I think when we go through school, you're getting, you know, stuff from like a chapter book that you're actually reading. It's not put in that same scope of practice. And I really wish I would have started sooner because it was pretty stressful there for a few months.
I bet, yeah. Well, that wraps up the questions that I had for you. Do you have any questions for me?
No, I don't. Thank you so much, Riley.
Awesome, thank you.
Thank you.